first technique we're going to do is a mobilization with movement to help facilitate plantar flexion for her ankle on the right. So what we're going to do is have the patient kind of at the end of the table to where her heels are hanging off the edge. We're going to have the involved knee just bent slightly, just like that, just so her heel is planted on the table. And what we're going to do is add a posterior force to her tibia, like that. And then I'm going to have her actively plantar flex. Perfect. Is everything okay? And if there's no pain, go ahead and actively plantar flex. You can add a little bit of overpressure as well to increase the stretch. So we're going to do that 10 times. Go ahead. Good. Come back up. Good. Any pain? All right, and we'll do that for 3 sets. Good. Next, we're going to do a stretch for the piriformis muscle on the right. So this is kind of right underneath her right butt cheek. So what we're going to do is have the patient cross your right leg over your left. And then instead of bringing your knee up to your chest, we don't want to do that. We're going to actually stabilize your knee right where it's at. So we don't want it to come up. We don't want it to go down too much or anything like that. We just want to keep it right here. And then again, instead of bringing your knee to your chest, you're going to slowly lean forward and bring your chest down to your knee. Perfect. And then do you feel a little bit of a stretch?
Yeah.
Perfect. All right. And then so you can come back up. And we're going to do that holding for 30 seconds each time, and we're going to do that 3 times. Good. And again, making sure that your knee doesn't rise up. Just applying some gradual pressure, and then you can come back up. Perfect. The next thing we're going to do is just a range of motion exercise to facilitate great toe extension on the right. So what we're going to do is have the patient just be seated here with her feet shoulder width apart ideally. And then we're going to have you, I'm going to ask you to just raise your heels off the floor. Perfect, just like that. And you're going to be keeping your big toe flat on the ground. Awesome. And if you could go back down and then come back up. And what you really want to focus on is putting your weight through the middle part of your foot right here. So making sure that your weight is going through here and not coming through the outside. Perfect. All right. And so we're going to do that 10 times. Another thing that we can do to kind of help make sure that her weight is going through the middle aspect of her foot is add something like a TheraBand or a belt or something to kind of put her weight on. All right, so if you could go ahead and lift your foot up here. So you're just going to drive down into this belt, just like that. And if you can hold it. All right, and then go up onto your heel. Perfect, just like that. And come back down, and don't let me pull the belt out. Good, and back down. And everything all right? Mm-hmm. And we're going to do this for 12 repetitions, and we're going to do this for 3 sets. Next, we're going to have the patient do a low-level hamstring strengthening exercise for hamstrings on the right side. So what we're going to do is we're going to use a whiteboard just because it's a little bit tricky to get the towel to slide on just the table alone. But we'll lay that down, and then a towel under the involved leg. And you're going to drive your heel into the towel, and you're going to bring, as you bend your knee, you're going to bring your heel towards your bottom, just like that. And you can go ahead and bend this knee if you want to, just for some comfort. Perfect, just like that. And there's one. Come all the way up. Is that all right? Mm-hmm. All right, so we're going to do this for 12 repetitions, 3 sets. Perfect. Last thing we're going to do is a strengthening exercise for her adductor musculature on the right. So what we're going to do is have the patient be in sideline just like this, and they're going to take their top leg, cross it over top of the bottom leg, and so then the bottom leg should be just extended out just like that. And then we're going to ask the patient to lift their leg off the table, perfect, just like that, and then lower it back to the table. And so we're going to do 10 repetitions, go back up and back down, just like that for 3 sets. Progressing from there to make it a little bit more challenging, we can add some ankle weights. Is that all right? Mm-hmm. All right, and then once again, if you could lift that foot off the table, perfect, just like that, and back down, and we're going to do this for 10 repetitions, again for 3 sets. Next, I'm going to demonstrate a squat with proper technique. So what we're going to do is have our feet shoulder width apart. We don't want to be too externally rotated or too internally rotated. Just toes out in front of you. They can be pointed outward a little bit, just not too excessively. Then we want to keep our chest up. We want to make sure that our back is straight and erect the whole time. We don't want to be hunching forward or leaning forward. And then we want to make sure that our rear end is being pushed backwards. So we're not necessarily going to lean forward like that. It's more of like pushing your rear end back as though you were going to sit down in a chair. So I'm going to keep my hands overhead to cue myself to remain upright. And again, driving into our heels, not on our toes, moving our rear end back and keeping our chest upright. All right. And again, we don't want to be on our toes. We want to make sure that our back is not rounded like this. We want to make sure it's straight and that our chest is upright. Driving with our heels.